Hypogonadism is an reproductive health issue. Look at this picture shows that MRI findings. Look at this CT scan to detect abnormalities in pituitary and hypothalamus and disease mechanisms. A detail going on. Introduction. Hypogonadism is a medical condition characterized by reduced or absent function of the gonads, ovaries in females and testes in males, leading to low levels of sex hormones, estrogen and testosterone. This condition can affect individuals at any age and has significant implications for physical and emotional health. The onset of hypogonadism can be primary, originating from dysfunction of the gonadal themselves, or secondary, resulting from issues in the hypothalamus or pituitary glands, which regulate gonadal function. Etymology. The term hypogonadism is derived from the Greek words hypo meaning under or below and gonad meaning sex gland, referring to the insufficient function of the gonad, ovaries or testes. The suffix ism denotes a condition of disease, indicating a disorder involving low gonadal hormone production. A definition. Hypogonadism refers to a clinical syndrome where the gonads produce insufficient amounts of sex hormones, resulting in reproductive and other systemic dysfunction. In males, this is typically marked by low testosterone levels, while in females it is characterized by insufficient estrogen and progesterone production. Types. 1. Primary hypogonadism caused by dysfunction of the gonads, testis or ovary, which fail to produce adequate levels of sex hormones. This can result from congenital conditions, trauma, infections, or aging. 2. Secondary hypogonadism occurs when the hypothalamus or pituitary gland fails to properly stimulate the gonads, leading to insufficient hormone production. This may be caused by tumors, genetic disorders, or damage to the hypothalamus or pituitary gland. 3. Hypergonadotropic hypogonadism A primary hypogonadism, where there is an elevated level of gonadotrophins LH and FSH due to gonadal failure. 4. Hypogonadotropic hypogonadism occurs when there are low levels of gonadotrophins LH and FSH due to pituitary or hypothalamic dysfunction. Causes. A. Primary causes. 1. Genetic disorders. Example, Klinefelter syndrome, Turner syndrome. 2. Aging. Age-related decline in testosterone in male and menopause in women. 3. Testicular or ovarian trauma or surgery. 4. Autoimmune disease affecting the gonads. 5. Infections. Example, mumps affecting testes. 6. Cancer treatments. Example, chemotherapy, radiation. B. Secondary causes. 1. Pituitary tumors or disorders. 2. Hypothalamic dysfunction. 3. Chronic illness. Example, chronic kidney disease, diabetes. 4. Stress or severe weight loss. 5. Obesity. 6. Certain medications. Examples, steroids, opioids. Risk factors. 1. Age. Testosterone levels naturally decline with age in men and women experience. Menopause. 2. Genetic disorders, conditions such as Klinefelter syndrome for males and Turner syndrome for females increased the risk. 3. Trauma or surgery, injury to the gonads or surgical removal of the ovaries or testes can lead to hypogonadism. 4. Infections, conditions like mumps or sexually transmitted infection can damage the gonads. 5. Chronic diseases, conditions like diabetes, obesity, and chronic kidney disease can affect hormone production. 6. Medications, use of drugs like corticosteroids, opioids, or chemotherapy drugs can interfere with hormone production. Complications. 1. Infertility, reduced production of sex hormones can impair reproductive function in both male and females. 2. Osteoporosis, low levels of sex hormones increase the risk of bone density loss and fractures, especially in postmenopausal women and older men. 3. Cardiovascular issues. Testosterone deficiency in men is associated with an increased risk of heart disease and metabolic syndrome. For sexual dysfunctions, low hormone levels can lead to decrease in libido, erectile dysfunction in men, and vaginal dryness in women. 5. Psychological syndrome. Low hormone levels may contribute to depression, anxiety, irritability, and fatigue. 6. Decreased muscle mass and strength. Testosterone deficiency can lead to loss of muscle mass, which can affect mobility and strength. Pathophysiology. The pathophysiology of hypogonadism involves a disruption in the normal production of sex hormones, leading to various systemic effects. The process can occur through primary or secondary mechanisms. Depending on whether the issue originates in the gonads or the hypothalamus pituitary. Below is the step by step explanation of the pathophysiology. 1. Primary hypogonadism, gonadal dysfunction, decreased feedback to hypothalamus and pituitary, increased gonadotrophins, inadequate gonadal response. 2. Secondary hypogonadism, hypothalamic or pituitary dysfunction, reduced gonadotrophins, decreased gonadal hormone production. 3. Hormonal imbalance and effects, lower testosterone or estrogen levels, impaired sexual function, bone health, metabolic effects. 4. Systemic manifestations, cognitive and emotional effects, low levels of sex hormones are linked to cognitive decline, depression, and mood disorders. Testosterone and estrogen play a role in the regulation of mood and cognitive function. Muscle mass and strength. Testosterone helps in the maintenance of muscle mass, and its deficiency can lead to muscle weakness, reduced strength, and fatigue. Infertility. Both male and females may experience infertility due to the lack of hormone production, need for sperm, or egg maturation. This step by step process illustrates how the dysfunction of the gonads, primary hypogonadism, or the hypothalamus or pituitary, secondary hypogonadism, leads to the clinical signs and systemic effects associated with hypogonadism. Signs and symptoms. A men 1. Decreased libido or sexual desire. 2. Erectile dysfunctions or impotence. 3. Decreased muscle mass and strength. 4. Increased body fat, especially abdominal fat. 5. Infertility. 6. fatigue, depression, and mood changes. 7. Reduced facial and body hair growth. 8. Osteoporosis or bone fractures. 9. Hot flashes. B. Woman. 1. Irregular or absent menstruation. 2. Infertility. 3. Hot flashes and night sweats. 4. Decreased libido. 5. Vaginal dryness or atrophy. 6. Mood changes, anxiety and depression. 7. Decreased bone density and risk of fractures. A diagnosis. 1. Blood test. Measurement of sex hormone levels. Testosterone in men, estrogen in women, and gonadotrophins, LH and FH. Low levels of these hormones are a diagnostic. 2. Imaging, MRI or CT scan may be used to detect pituitary or hypothalamic abnormalities such as tumors. 3. Genetic testing. In case of suspected genetic disorders, example, Klinefelter syndrome, chromosomal analysis can help diagnose the condition. 4. Pelvic ultrasound in women to assess ovarian structure and function. 5. Semen analysis in men to evaluate sperm count and mortality if infertility is suspected. Nursing diagnosis. 1. Impaired sexual function related to hormonal imbalance and reduced libido. 2. Risk for infertility related to low gonadal hormone levels and impaired gamete production. 3. Risk for decreased bone density related to insufficient estrogen or testosterone levels. 4. Fatigue related to low hormone levels and physical weakness. 5. Anxiety related to hormonal changes and impact on quality of life. Management. First, medical management. 1. Hormone replacement therapy, HRT. For both men and women, testosterone in men or estrogen and progesterone in women can be prescribed to restore normal hormone levels. A. Testosterone replacement available as injections, topical gels, or patches. B. Estrogen and progesterone therapy for women. Hormone replacement can help manage menopausal symptoms and prevent bone loss. 2. GnRH therapy. In case of secondary hypogonadism, GnRH and gonadotrophin therapy may be used to stimulate gonadal function. 3. Fertility treatment. Associated reproductive technologies, example IVF, for patients with infertility. 4. Bone health management, calcium and vitamin D supplementation along with bisphosphonates or other medications to prevent osteoporosis. nursing management. 1. Monitoring. Regular monitoring of hormone levels and treatment efficacy. 2. Psychosocial support, offering counseling and emotional support to patients coping with changes in sexual function, infertility, or psychological symptoms. 3. Education, educating patients about the conditions, treatment options, and potential side effects of hormone therapy. 4. Lifestyle modifications, encouraging regular exercise, a balanced diet, and smoking cessation to improve overall health. 5. Bone health education, instructing patients on how to prevent bone loss, including weight bearing exercises and adequate calcium intake. Treatment options. 1. Testosterone replacement therapy TRT for men with low testosterone. 2. Estrogen and progesterone therapy for women with low estrogen levels. 3. Human chronic gonadotropin HCG therapy for secondary hypogonadism in men. For fertility treatment options such as in vitro fertilization IVF for patients with hypogonadism related to infertility. 5. Osteoporosis management bisphosphonates, calcium and vitamin D supplementation to promote bone health. Psychosocial medicine. 1. Counseling, provide psychological support to help the patient manage emotional challenges such as mood changes, anxiety, or depression. 2. Support groups, connect patients with others who are dealing with similar challenges, especially concerning infertility or sexual dysfunction. 3. Couples therapy, address relationship dynamics, especially if sexual dysfunction or infertility is concerned. 4. Education, teach coping strategies for managing stress and the emotional effects of hypogonadism and hormone replacement therapy. 5. Mindfulness and relaxation, promote stress relief techniques such as meditation, yoga, or deep breathing exercises. Prevention. 1. Genetic counseling for individuals with a family history of genetic disorders like Neufilter syndrome or Turner syndrome. 2. Healthy lifestyle, maintaining balanced diet, regular exercise, and avoiding smoking. Alcohol can reduce the risk of secondary hypogonadism. 3. Screening, regular checkups for individuals at risk of secondary hypogonadism, such as those with chronic conditions or undergoing cancer treatments. In conclusion, hypogonadism is a common condition that can have significant physical, psychological, and social impacts. Early diagnosis and appropriate hormone replacement therapy can help mitigate the effects of this disorder. With proper treatment, individuals with hypogonadism can manage their symptoms and maintain a high quality of life. Thank you. Have a nice day.